Entering a modern intensive care or oncology ward means entering a world defined by machinery. It is an environment built for pure clinical survival, monitors, alarms, and sterile surfaces. When a patient is placed in this environment, facing severe physical trauma or the shock of a life-threatening diagnosis, they often enter what psychologists call a verbal vacuum. The pain and fear become so acute that language simply fails them. If you suggest bringing art into this space, the immediate assumption is usually pediatric waiting rooms, coloring books, or a casual hobby meant to pass the time. Treating profound emotional shock necessitates a structured clinical intervention. Medical universities are now formally training both undergraduate and postgraduate doctors in a specialized discipline known as medical art therapy. These medical students are studying the specific neurological and physiological pathways through which the creative process affects physical and mental health. To prescribe this therapy, doctors must master strict clinical protocols. They learn exact referral criteria, integrate sessions into overarching treatment plans, and document the outcomes with the same rigor as pharmaceutical interventions. Within this academic framework, the creative process is prescribed as a specific medical necessity. Before a doctor can prescribe art therapy, they have to know exactly what they are ordering. For medical students, this requires a clear differential diagnosis to separate it from other psychological fields. This graphic outlines two approaches. Left, art psychotherapy uses finished artwork to analyze deep emotional trauma with a specialist. Right, art as therapy focuses on the physical act of creation itself. This act triggers immediate relaxation, lowering pain and acute stress in real time. Instead of uncovering past psychological trauma, medical art therapy treats the acute physical and psychological symptoms of illness right there in the hospital bed. Bringing this practice into a ward introduces significant logistical friction. Creating art is inherently messy and subjective, which directly clashes with the highly regulated environment of a hospital. Every art material brought into an oncology or nephrology ward must be modified, restricted, or disinfected to meet strict infection control standards. Every session is heavily documented. Medical professionals track the patient's progress and measure the outcomes on a scientific basis. Art therapists integrate into a multidisciplinary team, working directly alongside doctors, nurses, and rehabilitation specialists. For the creative process to heal within these walls, it has to be administered with the exact same precision and oversight as any pharmaceutical medication. This therapy addresses the contagion of stress that spreads across the entire hospital network. For the primary patient, particularly those in palliative care, it provides a nonverbal outlet. This process restores a sense of human dignity and identity when their body is failing. Severe illness also strikes the family. Medical literature refers to this as caregiver burden, identifying family members as the second patient who suffer immense secondary trauma. Art therapy interventions provide these families with emotional renewal, offering a shared, positive focal point during an overwhelming crisis. Finally, the therapy impacts the medical staff themselves. Observing and participating in this holistic care helps doctors maintain deep clinical empathy and serves as an active measure against burnout. Medical art therapy functions as a systemic intervention, integrated directly into the clinical workflow. By treating the interconnected emotional reality of patients, families, and staff, the objective clinical outcomes for everyone involved improve. It is a meticulously engineered medical protocol, designed specifically to heal the human elements of suffering that machines and medicine alone cannot reach.